Good afternoon, everybody. I want to speak about the thyroid gland. I am a general surgeon, so usually the thyroid gland is one of the operations I do on a regular basis. But as you know, surgeons are not the first people to see patients with thyroid. Usually they go first to the endocrinologist. If they have any dysfunction in the gland, I mean either increased secretion of the hormones or decreased secretions of the hormones, they have to go to the endocrinologist to adjust the thyroid level to the normal. What they maybe send us cases, the endocrinologist, if the thyroid, hyperfunctioning thyroid is not controlled by the medication, by any means, by their specialities, then they send the patient, which is usually after 6 months to 1 year from the medical treatment which has failed, they send him for surgical treatment. And in this case, we remove almost the whole of the gland, leaving behind a small part which can return back the function to normal. The other indication for patients to come to a general surgeon for a thyroid gland is when they have a huge goiter. I mean, increase the size of the gland to the extent that it is pressing on the esophagus and the trachea and causing for them shortness of breath, especially on lying down, or difficulty in swallowing. This is the second indication. About the third indication, usually the patients who come for thyroid surgery, maybe they don't like the goiter or they don't like the gland which is looking ugly in their neck, and they come for cosmetic reasons. The most important reason for the patients to come to a thyroid surgeon or a general surgeon to remove their thyroid gland is when they have cancer in their gland. And usually the cancer appears in the gland as a nodule inside the thyroid gland. I mean a lump inside one of the wings or the area which is in between inside the gland. And usually the treatment is to remove that lobe, confirm that it is a malignant or cancerous lump, because usually the benign lump and the malignant are not very clear on fine needle aspiration cytology, so we have to do for them sometimes resection, make sure about the tumor, and then if we need, we can go ahead and remove the second part of the gland. That's all from my side. I hope if there's any more question, we can answer it if you send it on our website.